We are talking to Dr. David Rabin, who is Medical Director of Cardiology at North Shore Physicians Group. He is also my husband, and he is going to be talking all about the COVID-19 vaccine. How did the vaccine get here so fast? Why is it safe? How do you feel when you get it? And why is it so important to have it? Hi, David.
Hi. I'm a little bit, as you know, I'm a little bit out of my wheelhouse. This is all about virology, immunology, but I think this is really important to let people know how important this vaccine is and how safe it is and how crucial it is that everybody get it when it's available to them. And I know there's a lot of questions, a lot of misinformation about the vaccine, and I really feel it's important to get the right information out to people so they get the vaccine. So I know there's fears about, well, how could you get it so fast? Typically, vaccines take several years to produce. And well, what I wanted to point out is that we knew this, we knew what we were talking about. We knew this virus. We've seen this virus before. We saw it in 2003 with SARS. We saw it in 2012 with MERS. So we knew the enemy. We knew what we were dealing with. So when this came out in Wuhan, within 1 week, we had sequenced the virus, and we knew exactly what we were talking about. And within 10 weeks, Moderna had a vaccine prepared. So how could they get a vaccine prepared so quickly? It's because they've been working on this technology for years. The way I sort of think about it is, for New England fans, how could Tom Brady be so good when he stepped in after Drew Bledsoe got injured? He was so good because he had been practicing and he knew the playbook. He had been going through that playbook over and over and over again with the practice squad. So when Drew Bledsoe got hurt, he stepped in and he was ready. Well, we knew the playbook. We knew what we were dealing with. So when COVID-19 presented itself, we were ready. So we actually had a vaccine platform. Moderna had one ready within 10 weeks. So how could they put it together so fast and produce it so quickly? One of the big things is money. Pharmaceutical companies were given $18 billion to develop this vaccine. And it was, you get the money. You get the money whether the vaccine works or not. So they could start, once they got to the phase 3 trials, which is where the clinical trials, they started making the vaccine, okay, whether it worked or not. So they didn't have to wait until they completed the trials before the vaccine was starting to be produced. So they were already ahead of the game. So money talks. And these trials, so people understand, these trials were enormous. The Pfizer trial had 40,000 patients in it. The Moderna trial, over 30,000 patients. That is insane. I write for heart failure drugs and statins and things like that. And there's a drug that I use for heart failure, which had 8,500 patients in it. Mm. Think about it. And that was a huge trial. I mean, we've
just to be clear, David, in these trials, some people get the vaccine and some people get placebos.
Right.
And then they watch what happens, right?
Right. And one of the reasons, unfortunately, these trials went so quickly was that there was so much COVID. You didn't have to wait. You didn't have to wait until you had, I mean, a lot of these trials, you need to wait until you get enough cases in each group to decide whether things are efficacious or not. Well, they hit their cutoff quickly because there was so much virus out there.
And it was so contagious. So yes. People got it fast.
So people got it fast, and you had a lot of people who had it, so you could hit those numbers pretty quickly. And people are worried whether these companies are cutting corners. You have to understand that the regulations for vaccines with the FDA are tougher than they are for the drugs you take. So there's actually more hoops you have to go through to get a vaccine approved than your typical drug that you take. So no corners were cut. We had technology that's been worked on for 20 years. And actually within the last 4 years, major breakthroughs have come through this technology. So, and you had money. So all that leads to why these vaccines were produced so quickly. And so how do they work? And I think this is important for people to understand. If people are concerned, they go, well, I've heard people say, well, I don't want to get a third eye, or I don't want to mutate. They're worried that these vaccines are going to cause them to mutate. And that's not what these vaccines do. These vaccines, the Moderna and the Pfizer ones in particular, are what are called messenger RNA. And all that is a messenger. It's not DNA. It doesn't get incorporated into your cell and into your genome. It is just a very transient messenger that is delivered to your cell so that your cell makes the protein that's the spike protein for the coronavirus. And I have my own little coronavirus right here. And this is a ball with a lot of little cloves in it, but I don't know if you can see it, but the cloves, those are the spike proteins. That's what you see, and that's what your antibodies see. And what these mRNA, what it does is it causes your cell to make antibodies against this. That is it. There's no COVID in the vaccine. People are worried about, oh, am I going to get COVID from the vaccine? There's no virus in the vaccine. There's no COVID in the vaccine. It is just this messenger RNA, which is very unstable, which is why they have to be kept so cold. The Pfizer vaccine has to be kept, I think it's like 90 degrees below zero. Moderna, not quite so cold. And that's why its shelf life is very short. So once they take it out of the refrigerator and put it in the syringes, you have 6 hours before it's degraded. So this does not get incorporated into your genome. It will not cause you to grow a third eye or anything like that. So it is safe and it is effective. People wonder about allergic responses. People have read about anaphylaxis. Out of the first 2.1 million doses, there have been 11 cases of true anaphylaxis. That's ridiculous. Okay. I mean, you know, we do coronary angiography and we send people for CAT scans. You could go get a CAT scan and get an anaphylactic response to the dye. It happens all the time, you know, far more often than this. So to be worried about anaphylaxis is it's just not a player. Yeah.
I was just going to say, so you just received your second dose.
Yeah, I was going to say, so I took the Pfizer vaccine and I've had both shots, and I had my second shot 2 days ago on Wednesday, and you know I've been fine. You know, after the first shot, for the next day or two, I was a little logy. I didn't have fever, I didn't have chills. I had some muscle aches, a little fatigue, a little myalgia, a little malaise, but that's it. And it lasted a couple of days and went away. This one is actually less significant than the other one, and that's I've known some people who really felt the second one, but that's because you already have the first dose is a primer, and the second dose is what really boosts your immune response. So many people will get a more vigorous response, especially younger people. Younger than the age of 55 tend to get a more vigorous response. You know, us older folks don't get it so bad.
So David, you have said to me that people who have had COVID in the past, have recovered from COVID, will be hit hard by this vaccine.
Yeah, well, it's sort of like you've had your first dose, right?
Right.
So you're primed. But that's a very important point. If you've had COVID, you need to get the vaccine, because your immunity won't last. Now, there's some debate as to when you should get when you should get the vaccine, okay? I mean, if you just got over COVID a week ago, I wouldn't go get the vaccine.
Because
I think there's some debate about, you know, spacing it out like 90 days. So if you've had COVID, you may want to wait 90 days before you get the vaccine, but you still should get the vaccine.
And can you talk about treating the symptoms?
Yeah, so I haven't had to treat them, but you can treat the symptoms from the shot. So typically the symptoms are flu-like illness, muscle aches, fever, chills, headache, that kind of stuff. You can take, once you get the vaccine and once you get the symptoms, you can take either acetaminophen, which is Tylenol, or you can take ibuprofen, which is Motrin or Advil or something like that. You should not pre-treat. So don't think, oh, I'm going to prevent this by taking it, because there's some debate as to whether or not that may blunt your immune response. So I don't think there's a lot of literature out there, but the general rule of thumb is don't pre-treat. But if you do get sick, if you do feel poorly, and if you're really uncomfortable, chills, fever, that kind of thing, which is not uncommon, you can certainly treat that symptomatically with either acetaminophen, Tylenol, or ibuprofen, Motrin, Advil, something like that.
So, and David, are people pre-treating because some will take Tylenol before they get a flu shot?
Yeah, yeah. That people think, well, why should I get the symptoms? I'll just prevent them.
Yeah.
And in this case, an ounce of prevention may risk a pound of cure, so to speak. So I would stay away from that.
Mm.
But you know, these vaccines, when you think about the flu vaccine is about 50% effective in preventing the flu. If you get both shots, you are 95% protected against COVID, getting it at all. And you're 100% protected, at least so far, against serious disease. So even if you get it, if you're one of the unlucky 5%, 5 out of 100 that may get it, even though you got the vaccine, your disease course will be much milder than if you didn't get the vaccine. So it's important to get the vaccine. It's important if you get either the Pfizer, there's 4 that I know about: Pfizer, Moderna, those are the ones that are available now, AstraZeneca, and Johnson & Johnson. The Pfizer, Moderna, and AstraZeneca are 2-dose regimens. Johnson & Johnson, I think, is a 1-dose regimen. Pfizer is 21 days between the two, Moderna is 28 days. It's important, crucial, to get both doses, because you're basically only, with the Pfizer, about 50% protected against the first, after the first dose. I think Moderna, you're a little higher. But what happens is if you only get the first dose, there's concern that you'll wind up sub-selecting a more virulent virus. For example, if a doctor gives you an antibiotic for pneumonia or bronchitis or infection, they say, you know, take it for 14 days or 21 days or 7 days. And the most important thing is to take it for the duration, right? Because if you say, oh, I'm feeling better, I'll stop it after 4 days, you still have some bacteria that are a little tougher than the first batch. And you sub-select for those bacteria so that they're stronger and more virulent. It's a similar situation with the vaccine. If you only take half the dose, you run the risk of, well, you may be 50% protected against maybe slightly weaker strains of the same virus, right? Because you don't mount as robust an immune response. So then the virus that isn't eliminated by your 1 dose is left to propagate, right? So you're sub-selecting more. So it's crucial. This was the big thing. There was some debate about whether or not to try to get more people vaccinated. The Biden administration was just going to put out the first dose and delay the second dose. And they've been very adamant about that. Fauci and the rest of the team have been very adamant that they're not going to do that, that it's really, really crucial that you get both dosages to get the full benefit.
So, David, one big question on everyone's mind that I would like you to address is the issue of whether or not someone who has been vaccinated can still infect others. Can they still carry the virus, and are they contagious?
That's a great question, and I think they're not. Excuse me. I'm not really sure that the theory is that you should be less infected. Now, whether you are totally not infected or not, I don't know, and that's why people are stressing that even if you get fully vaccinated, that you continue to practice social distancing, wear masks and things like that, because we don't know. I mean, theoretically, you know, when you get the virus tries to replicate in you, but it gets destroyed, right? But there may be some period of time when you have some infectivity, and I think there's literature out there that just I don't know. I don't think there's the literature to support that yet. But for now, it's important to get the vaccine and get many people vaccinated, because the important thing is to get the number that people talk about is 70% of the population vaccinated in order to stop the spread of the virus and the propagation of the virus. The virus needs a place to go. It needs a home, right? If everybody's vaccinated, it has no home and it can't replicate and it dies. If we don't get enough people vaccinated, we're going to be dealing with this for a long time. If you only get 50% of the population vaccinated, this virus will be bouncing around among people that aren't vaccinated, and it'll keep propagating. We need to not give it a place to set up and to keep propagating.
And is it true that the longer it bounces around, the more it could mutate?
Sure,
And
that's a big concern, right?
Mhm.
You know, a big concern. I mean, it's already mutated slightly. There's this more infectious strain of it. It's not more virulent. It's just a little more infectious. But you know, we don't want to give this thing time, right?
Mhm.
We want to. We have an opportunity. I mean, you remember? I mean, we started talking. I forget the first time I spoke with you guys back in April, and we were praying for this. We were people were praying for this moment, right? So
Mhm.
now we have it.
Mm.
Now we have it, and we have such an opportunity because I look at this. I feel like I feel like I'm in the California wildfires, and all around us, this is raging, and it's just raging out of control. And here we have what's key to stop this from burning anymore and ruining any more lives and businesses. And I can't stress enough the importance, having seen people firsthand struggling with this, you know, and certainly, you know, what I've seen is nowhere near what, you know, they've seen in Arizona and in Oklahoma and in Florida and in Texas and downtown. You know, the hospitals downtown are packed with people still, and it's so critical.
I
Well,
didn't realize that theoretically this could actually be snuffed out.
Yes,
Yeah.
yeah, you put it out. It has no place to go, and it dies. SARS-1 died out. You know, that just died out. But they do. Now, you know, who knows whether this will mutate? You know, maybe you know, we may need to have, you know, booster shots down the road. I don't know. That's above my pay grade. But you know, right now, what's so critical. I mean, if people think, well, you know, we'll just let herd immunity take care of this. Well, if you go by the herd immunity theory, and you think about the mortality rate of COVID and patients over the age of 60, the mortality rate in patients over the age of 60 is 1 in 58. Okay, and if you're of color, it's 3 times that. So if you want to talk about herd immunity and you want to get 70% of the population immunized by herd immunity, that's 800,000 people over the age of 60 would have to die to get that. So that's think about how many people have died already. So the herd immunity theory is not possible. It's not feasible. It's not humane.
yeah.
You have a mortality rate of 1 to 3.4% with this virus.
Not to mention the burden on our healthcare system,
Yes,
trying
yes,
to take care of the people who have COVID and are surviving. I
yes.
mean, that would be just really impossible.
So, and you have people who have, you know, symptoms that last a long time. I mean, some people, you know, they're over and done with, right? But other people, you know, they can last. Some people, you know, their symptoms last months. Some people, they call them the long haulers, are dealing with this stuff for years. And the people that were really sick, the people that were intubated and on high pressure oxygen ventilator settings, you know, they have permanent lung damage that will follow them the rest of their lives. This is not something that you want to risk herd immunity with, you know, because it's just devastating. So the only way to get this thing under control by the end of 2021, and we can do it, is for people to get vaccinated. This is our moment.
Well,
I have a random question, Dave.
Sure.
The difference between the Pfizer vaccine, Moderna vaccine, are they basically the same recipe?
They're basically the same recipe. Yes, they're both mRNA in this sort of delivery system, which is, you know, I don't understand the delivery system, but it's a little lipid cholesterol kind of bubble, I think, and that's how they deliver it. I don't know the virology behind it. The AstraZeneca and the Johnson & Johnson, I think they use a dead virus, not COVID, but a different type of virus as the platform. But the whole thing is still geared towards this. It's geared towards making you get antibodies against the spike protein. And that's what you're going after. There's no COVID in the thing. You can't get COVID from the vaccine. You're not going to mutate and grow a third eye. I mean, I heard one person
saying
say, I
that.
don't want to take this vaccine because this is literally, I don't want to get this vaccine because I don't want to grow a third eye or another leg.
Wait, somebody said that to you?
Yes.
Well, they just hear the word mutate and then
Yeah, they hear RNA and you know, I understand. I mean, RNA, DNA, mRNA, RNA, DNA. That's not people's normal conversation, right? And this is complicated stuff, but it is safe. It is crazy effective. I mean, 95% effective. They weren't even dreaming of anything like this when they were coming up with this stuff. So 95% effective and basically 100% effective against serious disease. And we can stop this thing and get back to our lives. If you don't want to get back to your life, don't get to that. You know, we have a choice, you know, and we have options. So